Missouri is refuting the data by the CDC that thousands of doses of the COVID-19 vaccine have not been used. News 4's Caroline Hecker is watching out for you tonight and seeing if the state's claims line up.
Governor Mike Parson says more Missourians have received the COVID-19 vaccine than the current data would suggest. In fact, he says it's largely due to reporting delays from both vaccinators and the federal pharmacy partnership that is skewing the data. When doses of the COVID-19 vaccine arrive in Missouri, they are immediately distributed where they're needed. Right now, the state is receiving about 80,000 doses per week. The state gives vaccinators 10 days to report their numbers, and Governor Parson says dozens of vaccinators around the state are still reporting manually.
This backlog causes the total number of vaccines administered to appear much smaller than it actually is.
But here in St. Louis, hospitals use Show Me Vax, an online web portal to report their numbers at the end of each day.
The end of my vaccination day, literally as soon as the last person is vaccinated, I can go and run a report in Show Me Vax, and it will tell me exactly how many doses I've administered that day, which I then reconcile against our schedule and how many I know, just to make sure that it's gone through.
That data closely monitored by the state to help determine who gets more or less in their next shipment.
We watch it very closely. Okay, you got 1,000. You've told us you've administered 500. The clock's ticking on the other 500 because we control the allocation.
The state dedicated nearly 150,000 doses to the federal pharmacy partnership to help with vaccinations at Missouri's 1,300 long-term care facilities. But so far, that program is only reporting around 30,000 people have received the vaccine.
So they're either doing it as we speak and haven't reported what they've done.
Williams says that leaves at least 100,000 elderly people who have likely been vaccinated, but are not yet included in the state's overall number. Prior to the Show Me Vax interface being set up for COVID-19, vaccinators had to input their data manually. Tracy Williams with SSM Health says her first 300 patients took nearly 10 hours to record. In St. Louis, Caroline Hecker, News 4.